Zimnandi ziyaphinda. It's in the morning, and I'm hoping that you are probably sleeping. Unless you are at work.
Yeah.
We are here.
Yes.
Obvious. We couldn't be anywhere else but at the studio. Trying to make sure that you get what you were expecting and what you expect most if you wake up or if you're at work. Emily, it's greetings from my side. Even my voice, I'm sure it's totally different. It's 3:20 in South African time. That is 20 minutes past 3.
You are rubbing it in.
No.
You are rubbing it.
No, I'm not. I'm just enjoying. I mean, recording after sleeping.
After
I
sleeping,
think it's much better. I'm more healthier than I would have thought compared to me shooting before going to sleep.
Yeah.
But after sleeping, it's like a morning shift.
Okay, if you say so. Well, guys, welcome back to the Ntanzi Reality YouTube channel. Most of you are going to see this probably in the early hours for those who wake up. But we are here. I know a lot of people may be thinking that we were dodging this one because the medical terminology and the biology and what's. Okay, it was difficult to capture, analyze, and, go through this testimony of this dentist.
Wasn't that
He was on a mission.
part of the mission to make sure that you don't understand
Anything.
if you didn't
feel
study
like
biology?
yes.
But it felt dismally because we still were able to decipher what we needed from this. I think even the defense didn't even need.
Yes, they did a spectacular job.
To consult with the other doctors. They just hit this doctor, dentist, exactly where it was supposed to be hit. And more so when it comes to Nisi, who did not take it lying down, that you are going to come here and give us some terminologies and we take them, we eat
and you
them.
use like a heavy biological language of a student as you are learning and you have enrolled for medical school and you learn all these new words. He was like, I'm going to bombard them. I'm going to make them, be overwhelmed in their heads. I'm going to confuse them. Yeah, it was a strategy indeed. And you could kind of feel like, I thought Gininda was over-explaining, but this one, he was on steroids.
No, it never worked.
Yeah.
I think also with an experience of what Kinindi did to the defense in terms of doing all this and that. Over-explaining. They are now well aware. They can hear him speak because today it was more like Ginindi speaking, testifying now about medical stuff.
Yes.
If you ask me, the character was more or less the same, except they were not able to keep up with the kind of explanations that they were giving for long.
And remember Dr. Steenkamp, who's a forensic pathologist, the one who examined the body of Senzo Meyiwa, he communicated in a simple manner. You would understand what he was saying, for someone who was working like that.
Yeah,
like a forensic pathologist has studied more and is at a higher level than a dentist. But his testimony was to the point. His testimony was everything. He didn't take long either.
Look, when you are going to have to present something that requires education, more so in the field that you are at, you have to consider the audience you are presenting on. If it's a blue audience, definitely you can shoot. In this case, I guess the what we call the lawyers blue audience, they are able to comprehend and understand. It did not work. What it came to do for me, if you ask me, it was irritated towards the end.
He started sounding angry, impatient, and all of that.
No, it did not work.
Yeah, it was very interesting court today, okay? So, yeah, Banye, they called him Dr. Zifozonke on the chat. I was laughing.
He almost got away with that position of being Zifozonke, which would loosely translate to all diseases, examiner.
It's a doctor of all diseases. Yes. So the state apologized for the late start. Now, they said that accused number 4 was brought late to court. They said that there was an incident at the prison and the warders had to assist with that incident before they could transport accused number 4. So the state called its last witness in the Senzo Meyiwa trial within a trial.
Yes.
A dentist who examined accused number 2, Ntanzi, on the 22nd of June 2020 in the period in between making him making those 2 alleged confessions. His name is Dr. Tabang Hlokwa. That was the witness. And he was also not on the list. And he's a dentist with a Bachelor of Dental Surgery. Dental surgery.
Yes. Yes.
Yabo. Yes. He completed his studies at Sefako Makgato, previously known as Medunsa, in 2014, and he studied there for 5 years, he says. And he said that they were trained in examining a patient from the waist up, including the face and oral cavity. I don't know why he included the whole waist up situation and the face. And I don't know what was the aim here, but he had a direction that he was covering, and we're going to point it out.
Yeah, it does seem like that. You start including the whole upper body now, which is almost everything.
Beyond the scope of what you actually studied.
Yes.
So he said, if we check the whole body and we see anything that is not in our scope, we are trained to refer that person to a relevant physician. This is practically every healthcare worker, in my opinion. This includes nurses. This includes everyone who's working in the healthcare facility and is dealing with patients. Whenever they see something alarming, they refer to the appropriate specialist or the appropriate person who can evaluate that. It's for everybody. It's not just dentists. So it was quite interesting how he was covering his testimony. And he was talking about lacerations using heavy medical terminology, like he was revising things that he was studying for an exam. He said these include broken and dislocated jaws, injuries on the face or mouth. Those are referred to other. He said he makes a referral to other general practitioners or doctors. Advocate Baloyi asked him to put his work experience on the record, and he said he did his ComServe, which is community service, from 2020 to 2021 January in Tlhabane Community Health Care Center District.
He did his community service?
Yes.
Is that when they met?
It was during the time that Ntanzi was taken to that Tlhabane Community Health Care Center.
Okay.
So from 2021 till present, he has been in private practice and even has his own establishments that he runs. So straight from community service to having multiple establishments that he runs. That's very interesting. And he said he still works at that practice, the Tlhabane Community Health Care Center. He's still working there as a dentist even now. So Hlokwa was shown a document, okay? And Baloyi said to him, do you recognize that document? And he said it's a form that they use in the Northwest District for examining a patient. It's a standard form that they use. And Hlokwa was asked to read the document onto the record. Hlokwa said it's Hlabani Central Health Community Center, and the form starts off by patient's name, Bongani Sandiso Ntanzi. At the time, he was 29 years of age.
Yes.
Hlokwa continued to read personal information, particulars, and Baloyi asked, you mentioned that he was a prisoner in Ntanzi, and he said, given where Hlabani district is, it was rare for them to encounter prisoners. Please highlight this. Because later on, it switches. But here he was saying that it was rare for them to encounter prisoners. In fact, he was the only one that he had ever seen. Ubongani Ntanzi was the only one that he had ever examined. Hlokwa recalled that Ntanzi was escorted by a police officer and he was in handcuffs when he arrived. Hlokwa said that the officers who accompanied Ntanzi went outside and they left the door open. They told him if there is any problem, he should shout. So literally there was no, in my opinion, because the police said he must keep the door open. So there was no doctor-patient confidentiality. It wasn't there. I mean, they had to open the door, right? Because they treated him like a convicted prisoner.
Yes.
So Hlokwa said, in this situation, the cop indicated the patient Ntanzi come for an oral examination. And guys, I have to highlight this because in such circumstances, how was Ntanzi expected to communicate that I am being beaten to that doctor? Let's say maybe it was his final, person to report or to ask for help if the allegations of assault were taking place. Now the police officers are like, no, keep the door open as you consult with this person. And he's saying it's a prisoner, but he's not wearing correctional facility attire. Right?
Yes.
So these things, you must look at them. Don't just brush them off as if they mean nothing. They matter. So Hlokwa said, the policeman said, I must check if the patient had a gold tooth. And Hlokwa said Ntanzi had previously had a molar and premolars removed. 3 to be exact. So molars and premolars, for those who may not know, is the teeth that is at the back, the teeth we use for grinding food when we eat. So Hlokwa said every healthcare professional needs to do a questionnaire to determine if there's any other disease, as this could affect treatment. It also scans for allergies. Hlokwa said that the patient did not have any allergies. He said he had a heart disease. This was from a 2014 mining accident that happened, but he indicated that he wasn't taking any medication for it. The patient couldn't elaborate further on that, and Hlokwa said he also asked the patient if they were aware of their HIV status, and the patient said that they were not aware of that. He said venereal diseases, they were checking the vascular system to check if they have vascular thrombosis of the legs. We moved all the way from the mouth to the legs in this testimony, okay? From a dentist. Yes. So Hlokwa said he also said he doesn't
did you
have
call
TB.
It's thrombosis.
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 He
Yes.
also checked if there is a bleeding disorder. He said he doesn't have bleeding problems and wasn't on any medication. They said that they don't smoke as well. Ntanzi is not a smoker. He's a non-smoker, allegedly. He also asked for mental disabilities, if they had been to a psych ward, and the patient said no. So this is the field of psychiatry and psychology, Mtakabao, and he was testifying on it, okay? And generally, he said, we ask if the patient is pregnant or not, because it's a man. Obviously, they'll take a no, and men can't be pregnant. In this dental examination, this dentist cares for such that you must disclose your pregnancy. and asked if they had epilepsy, and the patient said that they have never had fits. Let me take a moment to pause. I have been to a dentist. I have never been asked such questions.
No.
This is my experience. I don't know about you guys. Maybe you have. Maybe the ones who go to private dentists. Maybe
No,
this
I have been to private dentists too.
do they feel?
No.
Did they check? Do they ask you such questions?
They don't.
So kidney problems and high blood, they said no, they don't have any of those issues of high blood, and they're not taking any medication, including diabetes, ulcers. Now, this is the part where I felt like time was being stretched here and the dragging was happening.
Yes,
okay, this
yes.
person was asked to check whether the patient had a gold tooth, and they went above and beyond, posing as a GP or a surgeon, a nurse, a psychologist, a psychiatrist, a heart surgeon, bona, kiri, everything above and beyond.
Yes.
So Hlokwa said there were no abnormalities when it comes to the patient, and this was rather interesting. You know, he was here starting to mold his testimony to accommodate the debunking of the allegations of torture.
I'm wrong.
He was over-explaining.
No, I'm wrong this time.
He was trying to sound like an expert. You know?
Kuri, Nisi just got angry. Was like, hey man, come on now.
Aye. Munisi dealt with him. He also spoke on the blood pressure and the pulse that is screened by medical people. And notice how he did not include himself here when he was speaking of the pulse and the blood pressure. He did not include himself. He's not the one who took accused number 2's blood pressure as well as the the pulse. So he said that if it's high, yet he testified, he educated and he lectured the country that if it's high, they say it's high, it's over 120. So 100 over 120. The blood pressure was below and within the rates of the expected range of it being high. So it says that the blood pressure was normal for an individual. If they had been in a fight, the blood pressure would be high. This was another way he was shaping his testimony to debunk the assault allegations against the police.
Hey, in my head, that man, I was like, icon. We are going to learn biology by force.
By force, Mtakabao. That's why it even took me so long to go through his testimony, because I'm like, he's taking us to biology class, okay? He didn't need to do all of this, but he did it anyway. So it was a 117, of course. Baloyi had to point it out. I mean, he had to have him read exactly what his blood pressure was at the time. And it was 117. And he added on, Afagi Aromet Mtakabao ati, it's normal. It's a normal blood pressure.
Meaning there was no sign that you were involved in any fight or some sort of torturing.
That is the narrative that was being portrayed here. And the pulse was also normal according to the screening that he never did. This dentist never did that screening for the pulse. So he said the pulse rate is 72 within the normal range, and it was signed the 22nd of June 2020, 12:52. That's when the patient was seen. And also remember that he also appeared in court on that day at Tlhabane. So after the court appearance or before the court appearance, I don't know exactly which one happened first, but he also was taken to a dentist. So he was also looking for bruises around the neck. Oh, dentist.
Why?
He looked.
Why?
No. He looked for the bruises around the neck.
What informed that, doctor? Why would you go on now and look for the bruises around the neck?
Who instructed him to do this? That is the question we all have. He declared that the patient looked normal at the state of being examined. Another plot to debunk the allegations of assault and torture. Hlokwa said he also examined the TMJ and called it the temporomandibular joint at the ear.
I remember those terms. He was there to tell us. That point where you're like, no, I understand. Why you don't understand anything?
The clicking sounds, usually for patients who have been in an accident. He said he did that for Ntanzi. When someone has cracked their neck and then when you twist it, that whole situation, that is what he was doing to Ntanzi.
Did you say he did that?
He said he was checking for it. He was checking for that injury that one would have when they get in an accident and then maybe they crack their neck.
Oh, hey,
he was guys. I know some of you are irritated by the fact that I laugh as I deliver this news, but it's unbelievable. It's interesting. A dentist doing all of that.
Yes.
And a joint at the back of the neck. At some point he also said yebo like Zungu. And I'm like, this yebo will never go away. Wena umutswana or umusoto or yapedi, I don't know. But what are you saying yebo for? Then Baloyi said, what were the clinical findings regarding TMJ? And Hlokwa said that they looked normal. The patient didn't have any abnormalities. Now we see why he brought up the whole neck situation.
Hey, Baloyi.
To say that there were no injuries.
It's tough.
Another plot to debunk the allegations.
It's tough being this man. Can you imagine when you prep these witnesses? Remember, you must align to their profession. More so like these ones of doctors and whatnot.
Even when he was testifying, I was laughing throughout. And I know, I was laughing. And I'm like, what is happening? This person is a dentist, but they are testifying like they are a
general practitioner,
a district surgeon. They are testifying like they are a general practitioner. Yes, they were testifying. It was such a weird testimony. I couldn't stop laughing. I'm like, because I know maybe basic terminology of biology. I didn't study medicine, you guys, or anything like that. I just read a lot on it. But I'm like, what is going on? What is happening? Why is this dentist testifying like a GP?
Next thing that was left was to tell us, I tested for fibroids and
hey, he was going there, Belle. I was like, oh, this is not happening. It looked so unreal. It sounded so unreal. To me, it sounded like, is this happening? And then Hlokwa also said that in this case, the patient's lymph nodes, because he was also asked about the lymph nodes. He said they checked the lymph nodes as well between the neck and the jaw. The lymph nodes are some of the stuff that's inside around this area, and in this case the patient's lymph nodes were not normal, he said, and we didn't find anything. He even said it is for cancer patients. And I'm like, for cancer patients, and here you are going above and beyond Mtakabao. So except for an infection, is there anything else that can make the lymph nodes to be hard or swollen? Asked Baloyi. And Hlokwa said that it is in specific states where the patient was involved in an accident or assaulted. Another attempt.
So tell me this. I see the doctor explaining this terminology. Baloyi's line of questioning. What happened? Do they communicate that, okay, Chief, you must ask 1, 2, 3, doctors, this is how you ask them. You ask, Baloyi would not know anything about that SNEMF note.
I would. He's a state prosecutor in this case.
Yes.
So he is looking for things to debunk the assault allegations.
Like, it feels, what I'm trying to say, it feels like these educated, learned people who come to testify, it's like they send him questions. Like, these are questions that you can ask me. It feels
I don't know. Do they prep before?
I know that you can do your own research as a lawyer, but these questions and the follow-up and whatnot, it felt like, when you're going to write one of these learners
like he studied
in South Africa, where they say, just write whatever, we'll correct it for you. And then here's the questions that you should look at. It looked like that.
It sounded like he studied.
Yes.
It did. He was studying. Yeah, it sounded that way. His testimony sounded that way. So Hlokwa said they also conduct an intraoral exam to check if there are any cuts or blood clots. He says this is usually seen in the mucosa in the mouth. This is yet another attempt to debunk those allegations that accused number 2 made. So Hlokwa said they also check the floor of the mouth and the saliva glands to see if there are any abnormalities. There might be blockages if there's any trauma. So this is his speciality. I have no beef with him here because it's the mouth, He adds that they also check the tongue if there are any bruises or swelling. Hlokwa said there were no ulcers or lacerations inside his mouth.
Yes.
After going the extra mile, he finally did what he was asked to do, to check whether accused number 2 ever had a gold tooth. Yeah, so he said that there was no sign of cosmetic work done on the teeth. There was not any presence of that, including a gold teeth. So in this case, there were no findings that Ntanzi ever had gold teeth inserted.
Yes.
That the patient ever had any gold
In
teeth.
a nutshell, something you could have just said, Ntanzi did not show such signs. Simple
Of
as
a
that.
gold teeth.
Simple as
And
that.
you know what the interesting thing is? He's not testifying on how he came to the conclusion. I was expecting more knowledge on how a dentist finds out if a person has ever had a gold teeth, what do they check for, and if he had any of those things that he checked for to determine whether a person has had a gold teeth or not.
Yeah, like give me sort of a skeleton. So for us to know if you have at some point had some cosmetic done on your teeth.
On your teeth.
This is what
are the signs?
Yes, this is what, you see, that explanation was acceptable. Hey, this one of testicles and whatnot.
Then Baloyi asked about the gingival infection or oral hygiene, how people should brush their teeth and replace a toothbrush every 6 months, and asked if it was linked to trauma.
Was that necessary? Was that necessary?
Guys. And the doctor said no. So Baloyi really wanted to highlight Bonkani Ntanzi's poor oral hygiene as it had any substance in proving the state's case. Hlokwa finished with the document and he said that his examination was about 30 minutes. He said that this was just a normal examination, nothing peculiar about it,
But it took how many minutes to testify? Was it isn't it more than 30 minutes?
Way more than 30 minutes. I mean, I rushed through everything. In fact, I didn't write everything that he was saying. I just took what I needed, guys. Okay. I took what I needed. It's what I do. I couldn't keep up. At some point, Komezulu was even saying the same thing. Even if you were to write down what he's saying, it's a lot. Then Baloyi said, asked him, you examined from the waist up, the head, the oral cavity, you inspected the face, examined nose and neck. And Hlokwa said, yes. So Baloyi said allegations have been made that this accused was electrocuted, tubed, assaulted some days prior to examination. And Hlokwa said in terms of assault, electrocution, he had his clothes on. From the appearance on the surface, I did not see any signs of electrocution unless it was under the clothes. Dokotela wa mazinyo.
Checking for
electrocution signs.
Yes.
Hlokwa said markings of choking on an individual show if they are choked and pressed severely. It will eventually show on the neck, and especially if they are light. So this choke, he's not talking about tubing, because I know that here on Mzansi Reality, we have to unpack these things.
Yeah.
Tubing is totally different from being choked and being strangled.
No, it is.
Totally different.
It's not the same.
Yes. So in this case, in terms of choking marks, there were no prominent choking marks. And Hlokwa said there were no marks that he was choked and on the face, and there were no lacerations. It was a normal person who was not in a severe altercation. The general appraisal is that they were not done these things unless it was done underneath the clothes. It didn't look like this person was severely beaten. Baloyi then asked, did the patient tell you he was assaulted? And Hlokwa said the person didn't state that he was assaulted. The only thing he stated was that he had a heart condition. Baloyi asked if he made a referral, and Hlokwa said...
You see what that is doing? It says this man has ample time to actually disclose to an independent person. That's what Baloyi was doing.
With the door open and the police here watching everything.
Yes.
Baloyi asked if he made a referral, and Hlokwa said he had to pass through the reception first before coming to him as a dentist. The screening was done. The first before they assessed them. In any healthcare facility, they are the last ones the patients will see. He also said that they rectify jaws. So basically, this question was not answered, in my opinion. So Baloyi asked, in other words, you are saying that a comprehensive medical assessment is performed on a patient. They take, Havana, this comprehensive, please, can I, with permission, repeat this question? Because Advocate Nisi brings it up later. You know, he brings it up. Mr. Anonymous, pay attention. This question, this is the question that Baloyi asked. He asked, in other words, you are saying that a comprehensive medical assessment is performed on a patient. They take his vital signs, they check for trauma, and then a patient is referred to you.
I heard that.
Hlokwa answered that is the last part of the examination, which is in most cases. He went on and on and on and on. But what I could pick up was that Baloyi was trying to be clever here, creating the impression that comprehensive medical report was done on Ntanzi. In other words, confusing the record. So Advocate Gomezulu stood to cross-examine the dentist. He started off by asking him, who gave you the power or the authority to examine accused number 2? Was the consent given to you by accused number 2? And Hlokwa said they brought him in and they explained to us what was happening. We need to speak to the police, and what we need to do is find out what the patient is here for, and to tell them that we are going to examine you in relation to our standard. The patient also has the right to say whether they want to be examined or not. Since the patient was taken from the prison and brought to us, and they don't disagree to what we are doing, we take it as the patient doesn't have any issue with what we are doing. So practically what he's saying here is that he doesn't ask for permission.
No.
what happens is he continues to explain to the patient what is going to be happening, blah, 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 blah. And if they don't resist, they take that as a yes. Dentist mtakama. You stay in your lane. A professional stays in what they are professional in.
And they don't become political when they come to testify.
No. They stay in their lane.
Now, if you were working for my company,
forensic pathologist
I'll
stayed
fire
in
the
his
hell out
lane.
of you. If you were working for my private company, I would fire you if I hear you testify like that.
A whole forensic pathologist stayed in his lane. He testified to what he looks for in the body of a deceased.
Simple as
He
that.
never spoke about what he looks for patients that are alive. There were even sometimes he was forced to make opinions or to give comment on opinions.
Stayed away when he needed
Stayed
to.
away when he needed to. You know?
Gave his opinion where the knowledge is available.
Exactly. So Mgomezulu asked, no, sir, I'm concerned about the privilege between the patient and the doctor. I cannot assume a privilege because before you examined accused number 2, did you meet with the police first in the presence of Mr. Ntanzi? Hlokwa went on to explain about how they have a queue and they have patients waiting outside, saying that they don't talk to anyone until the patient enters their exam room. What they are trying to do is avoid a conflict of patients coming in while the other ones are still busy with the dentist. It was a whole lot of explanation, really. It did not match answering the question. And all of this, at the time I was exhausted at this point. I was like, he said that when he talked to the police men there, he was also there, accused number 2. And he also said that there is no point where he was called into a corner. He said that he was told directly when the patient was there. Still not answering the question, you know.
Yes.
So Mgomezulu repeated the question again. Did Mr. Ntanzi give you the consent to examine him? Yes or no? Hlokwa answered yes. He can say that he did. When they examined the patient today, they explained to them before they do anything to them. That is what they are going to do. So according to him, explaining is a form of receiving consent. And they asked if they can continue to do, they agree or not. They say yes, they agree, and then they take that as consent. That's basically it. So Mgomezulu asked, do you have a consent form that was signed by the accused? And Hlokwa talked about the file for the dental, and he said that he is in possession of the file. The judge illustrated it on that document that he was testifying on, and he used there's a page there that says consent. Yeah, I think that's what the judge was using to show that permission was given. Abana judge now a testifier. Abana judge like mama judge and we are pig. He's denying the fact that he's actually testifying on behalf of the witness. He's denying it again and again, but that's exactly what he did here.
Me, I don't testify. I'm not testifying. That man can actually deny that he is testifying when he's about to testify.
He says, I'm not testifying now, and then he goes on to testify. I'm like, but judge, no. Why did you do that? And then Mgomezulu said that form was signed after. It was signed after everything was done on accused number 2. The examination or whatever he calls it. He said it's an assessment at some point while fighting with Advocate Mchololo. Inspection, whatever it's called. That whole thing that he was doing. That form was signed at the end of it all. It was not signed at the beginning to ask for consent. that do you give me permission to examine you?
Mm.
So Mgome Zulu said, I'm putting it to you that when accused number 2 was brought by the police, he was in the car and he was escorted by certain Metro Police officers. When the officers that spoke to you entered the facility, Hlokwa went on and on about how they were seeing other health workers before they saw him. He was giving me Dr. Matthew vibes. In my opinion, I watched Dr. Matthew, guys, the unfolding of that whole scandal that we were privy to last year. And let me tell you, he also has the same tendency of over-explaining and not really answering questions. I don't know where they get this skill. It's a skill, in my opinion. It's an interesting skill that people develop.
Of just saying things that do not align with what they are being asked.
Yes. It's marvelous.
No, it's not a skill. You can also do. You are capable of doing it.
Am I?
Haven't you went to an interview and you asked a question that is not make sure, and then you go on and on.
Okay, if you put it like that, I've been to interviews where I've had to do that.
Until that some person starts correcting you and be like, no, in layman's terms, this is what I mean.
There's a whole thing of fake it till you make it. This is literally...
Some of us have been into interviews from varsity. Here in South Africa, we are subjected to interviews of senior managers sometimes, senior maybe data scientist sometimes.
Okay.
Someone would ask you something, so take me through how, if you were to build a model. Can you imagine? Something you studied for like from first year, second year, third year, you have to summarize it in the real world.
Yeah.
And then you start explaining. And then that person later is like, so you don't check 1, 2, 3. And then you know for sure that, yeah.
I'm not getting this job.
I failed. So, and then he asked you, so you don't check 1, 2, 3. And at that time, you don't even understand
what
that
thing is.
And then later he asks you, so if you were to check it, what would you do? Yo, now upali code. Things that we go through.
With your mouth.
You're writing a code with your mouth. Whether you're writing it in C or Python or I don't know, you just are going to write that code. Depending on what that company uses, you're going to write that code.
You coding people go through a lot. Your interviews are intense. No way.
You get some people who really are just there to make sure that people that when they look at their face, they don't like, they don't get that job.
Yeah.
I mean, there's such questions are not questions that you should be asking.
But you would ask the one that you think would not fit in your company. You'd give them impossible to answer questions.
Yes, that's exactly how you start answering questions that are not asked. You answer them because you are confused or because you feel that the questions that are being asked are actually, they could actually put you in prison because you are lying. And then you start answering long essays.
Yes, you're trying to work your way out of a sticky situation. Okay, I've been in a predicament like that before. I don't know, it's adrenaline. It's adrenaline.
Because you know that you are caught with your pants down. Actually, it happens when you are caught with your pants down.
Well, Mgome Zulu continued to ask, during the examination in chief, you said that the police officers informed you to check a specific thing. And Hlokwa said he went on and on about protocol. He talked about the person that brought in the prisoner. He told the examiner whether the patient ever had a gold tooth or not. Mngomezulu said, in relation to the information you gave out as a doctor was not the scope upon which accused number 2 was brought to you. You exceeded the scope. You exceeded it. Hlokwa said he was going through the file. He did not go above and beyond anything that was written in his file. And they asked him, Bati, you are not a pulmonologist. Guys, at this point, I'm like, what in the heck is a pulmonologist? What is that? I didn't even get time to find out what it is. Guys, put it on the chat there. What is a pulmonologist? What is that? Pulmonologist spelled P-A-L-M-O-N-O-G-I-S-T. I don't know what that is. But Hlokwa said, yes, I'm a dentist. Everyone who goes through medical school is supposed to learn the basic function of the body. Then he went on and I couldn't keep up, you know. The man can talk, yo, guys. He can talk. Even Gomezulu could not keep up as well. And he's even ended up saying, sorry, even if we were making notes, we would not be able to take notes because the judge wanted to hear what Mgomezulu was saying, and he said he is talking medical terms and what. He's quick. We can't follow him. So I want to confine him to terms of legal aspects.
A pulmonologist is a doctor who specializes in lung conditions.
Okay. Oh, it makes sense. He is not a pulmonologist. That's not what he is. No, he's a dentist. You see, there are levels to this thing. What are you doing? Twisting necks and whatnot. And who asked you to do all of those things?
What if you break this guy's neck? Please twisting him.
Who asked you to do all of these things? I don't think he asked you to do that. So Hlokwa said he was supposed to be available until 1:30. This was before the adjournment. He said he had family responsibilities. But then the judge asked him if he will be available on Monday. And he said that Monday he will not be around. This is the dentist.
So he wanted to run.
Yeah, today. He wanted to finish his cross-examination once and for all today. It was very interesting.
Pulmonologist.
So after the long adjournment, Mngomezulu continued with his cross-examination and he asked him, have you ever asked him anything, this is accused number 2, related to his health or medical status? Hlokwa said that he needed to check the medical history before doing anything with him. He says that he did that. He checked Ntanzi's medical history. Ntanzi had medical history with the Tlhabane Center. Did he have it or not? I'm curious. Medical history. That is such a huge, it's a huge thing to claim. Medical history is usually with a doctor that you've had for years, right?
Yes.
Or maybe one clinic that you've attended like for all your life. Or for a long number of years. That's where maybe your medical history lies.
Yes.
It would be interesting. Gomezulu said regarding the HIV status, did you warn him about that he's not obliged to divulge his status? And Hlokwa said that he stated that they asked the patient if he was aware of his HIV status, and they said that they were not aware. But how he placed it in his examination in chief was very different. It sounded like he actually tested him for the disease. I don't know, you know. So he says that he didn't test him here. He just asked for the status, and whether he disclosed it or not was entirely up to him. So when the patient says that they've never been tested, they leave it like that. They also asked whether he did the test for COVID, you know. And Hlokwa said that they pass through the screening, like he said, through the reception, and then they do the COVID screening before they come to them. So literally here, when he says screening, he's talking about that whole thing before you entered somewhere. They'd have to check your temperature. What else did they check? They would check your temperature. Remember, during that year, 2020, they would check your temperature and they would give you a sanitizer to sanitize your hands before you enter places. Remember, that is what the screening is that.
Yes.
It's not testing. Testing was where they used that thing and they would, is it a bad? They would.
Yeah, that painful thing that
yes.
I'm happy I never had that encounter.
So screening and testing are two different things. So he's talking about screening, which was the norm. It was happening in every place, even malls, even stores, even shops. It was happening everywhere. You know, taking your temperature, writing your temperature. I remember I did a lot of those.
Even the securities
exactly
had access to
that. So he's talking about it as if it's testing. It was not testing. It was screening.
Test you. Hey, with that thing that sometimes was not even working.
So he said that Ntanzi had passed through that screening, through the reception, you know, and when they do COVID screening before they come to them, screenings are done by nurses, which are the vital group. There is no person who will come to them without passing through the vital group. Again, there were no tests that were done for COVID.
Yes.
No. So please note that he tested on some of the things that were done by this vital group. Already, it's not looking good, in my opinion. I'm like, you're talking about screening as if you're talking about testing. You know, my point, he said, my point is that the patient passed through a lot of people before they came to me. So Mgomezulu asked him if that form that he was reading from was completed by him or by the nurse. And Hlokwa said that he said it was filled in by two people, a nurse and himself. So, of course, his answer was much longer than this, but I picked up what I needed, and it said it was filled up by him and a nurse.
Yes.
So Mgomezulu asked, where in the form is it written that the COVID results were positive or negative? And Hlokwa said he didn't answer this question. He just gave another protocol long explanation. I didn't get an answer for this one. So Mgomezulu said, I put it to you that you acted beyond the scope of your instruction. I leave it for argument. I'm just concerned about where you indicated that accused number 2 had a heart problem in 2014. It was an incident at the mine, and you further said that he's not taking any medication with regards to that. You said you were told by accused number 2 that he has a heart problem. Is that what you said? And then they asked him again, were you told by accused number 2? Well, Hlokwa said that everything that Mgomezulu was asking was answered in the form that he was testifying with. After Mgomezulu repeated the question, he eventually said yes, after a very long journey. So Mgomezulu asked, my instruction is that accused number 2, where he was working underground. And no one can work underground if you have a sickness or chronic illness because it is too hot. Any person with medical defect cannot do anything. So he denied informing you of that, of which I am inclined to believe this more, Mr. Anonymous.
Yeah, the truth. They don't play around there.
Guys, they don't. I remember I once got an opportunity to go that side and I did the test and I failed. My blood pressure was high at the time.
So you can go with love.
No, you're not going underground. High blood pressure. And I really wanted the opportunity, but I was blocked by the blood pressure at the time.
And you didn't have any
I was
problem.
transferred to a nurse. I didn't have any problem health-wise.
You didn't have any blood problems?
No.
It was just
it was just
the
my blood
incident
pressure was too high.
that happened. Maybe you were afraid of
Maybe I was afraid of actually going underground. I don't know, but every time I would get on those exercises that you would do, and then they would test your blood pressure afterwards, mine was always high. And they were like, "You're not fit. You're not this. You're not that." Guys, I did everything. I went to the doctor. I even consulted. I'm like, "No, I can't miss this opportunity." But it's true. If your blood pressure or there's something wrong with you, slightest thing, chronic, you're not going underground.
Yeah, that's true. So it is wrong. They got it wrong that Ntanzi could have been working underground with such
A heart condition.
heart condition. No way. In no way of shape or form, Ntanzi would have been underground if that was the case.
And even at the time that they arrested him, he was working at the mine, right? So he, with a heart condition, I saw him talk about, no.
Afaka isijobelelo nje esingekho futhi esibashayo. Just doesn't make sense.
No. So he denied informing you of that. And Hlokwa said he could deny this. He said it's true. However, for blood pressure patients sent to a doctor to manage the blood pressure until it gets normal to a normal state before they go back underground. They could have had a heart problem. Then he got better and then he went back to work. That's not true. This is a dentist saying this. You know, does he know that a heart condition never truly goes away?
I know, not in his life.
Well, Mgome Zulu said, let's get into the point where my colleague was cross-examined or was cross-examining you on the way the accused alleged that there was an assault, or if somebody and they just said that they have been tubed. So according to you, are you in a better position to see if somebody has been tubed? The instruction is that the accused was never strangled. So according to his version, a plastic bag was put over his head. And when he was tubed, a plastic bag was used. Will you be able to see if a patient comes to you with this kind of, and you would be able to see if that person was tubed? And Hlokwa said that the only an autopsy can determine that a person was tubed. So this time a autopsy can do it. Pella, you have to be deceased for an autopsy to be done on you. And then they ended up passing away, and after an autopsy they'll be able to identify that.
Yes.
He said that there would have been lines if he was tubed by a plastic bag. That's when I was like, Dr. Matthew la. He's giving me Dr. Matthew vibes. Lines kanjani. For those who may not know, is when they take a plastic bag, they literally stop you from breathing for a while.
Yes.
They don't tie it around. No, it's just covering your face with the plastic and then holding it like this so that you struggle to breathe. So he even talked about bandages being used to strangle. The scary thing is that he was speaking with so much conviction. You know, that's what made me so uncomfortable. I'm like, why are you speaking like you know this to be a fact?
All I'm saying, I'm just saying this. If I had tooth problem outside of Rustenburg,
you're not going to the Tabani.
The whole of Rustenburg, I'm not taking my tooth out there.
The community health center.
I'm not going even there.
Tabani.
I'm just need to move out and maybe come to Gauteng, CBD. I would rather be that site, or just not to someone who explain things like that. Because next thing I'll be told that I have cancer.
Well, he continued to say that if that mark had been there and the patient was brought to him after 3 days, there is a possibility that it would have faded. He's bringing another light here. that I was not really thinking about. Yes, of course. If somebody was you, and then after a couple of days, those marks kind of fade. It's not about marks that would have lost it for a long time. He's saying that the marks would have disappeared. It's not like a plastic bag, it's like a rope. So Mgomezulu asked, when you first saw accused number 2, Bongani Ntanzi, he had no visible injuries, and Hlokwa answered from his point of view, and he said he never asked him to take his clothes off. So Hlokwa said that accused number 2 was brought to him precisely before lunch, at around 1 o'clock, exactly 12:52. He says that he concluded his examination 30 or 45 minutes later. So when asked to approximate, he said approximately maybe 1:30. Mgomezulu then said, have you encountered a situation where the police would confront you with the request of conducting a dental exam? And he said that at Medunsa, that's why, guys, I wanted you guys to highlight that other point he was making, that it was for the first time with Bongani Ntanzi that he had encountered where a prisoner was brought to him for consultation. Remember that?
Yes.
Now he was changing the tune with his cross-examination, and he said that at Medunsa they had to do a module where they'd have to treat people of the public, and they also treated prison people. So he said that they will see those prisoners within a month. So which one is which?
Can maintain lies. And obviously I'm saying this.
It's your opinion.
According to my opinion.
So in his examination in chief, he said that he was examining a prisoner for the first time with Bongani Ntanzi. But now he's saying at Medunsa, we did a couple every month. Mgomezulu said, I put it to you that on the day you conducted a general examination upon accused number 2, you infringed upon his rights to privacy, especially you breached the confidentiality of accused number 2 in relation to his medical status. What is your comment? And Hlokwa said, how did I do that? In the form he had expected to fill it. Basically, what he was saying is that he was doing his job. He says, I was doing my job. It was game over. Well, Gomezulu asked him, when you were conducting that examination, you said accused number 2, Bongani Ntanzi, looked worried. What do you mean by that? And Hlokwa said, why did... What I was meaning was that the facial expression, the way in which they were, he looked quite of concern. I wouldn't say that they are stressed, but they looked confused. I don't know whether they understand the setting or what, but that's a normal perception of any dental patient that is there. Any woman who enters the dental practice, they start wondering what's going on, what's going to happen next. I'm like, Makhwa, remo kaimu. What is he talking about? This cross-examination, what is it, 10-0? 10-0, eh? When did we reach pregnant women entering and then feeling confused? What is going on? Then Gomezulu then said, on the form where it says complaint, it's written the patient requested an examination for oral cavity. And Hlokwa said it means I was informed what the patient is requiring to be done to them. So they are saying that Bongani Ntanzi asked for examination for oral cavity. So Mgomezulu said, so that is hearsay. You were not directly informed by accused number 2. Hlokwa said, I'm going to go back to protocol. I was like, when he said he's going back to protocol, and them as medical professions, every time a prisoner is not the same as a normal individual, they are supposed to be protected by the person that comes with the prisoner. So interaction before they even go to that patient, the warder is the one who's supposed to explain what needs to be done to the patient. That's
Yes.
for their safety. That's what's supposed to be done. Yes. So, doctors, this is how it's supposed to be done, right? Please
Yes.
confirm in the comment section down below. Ngomezulu then said, when accused number 1 was brought to them, or to you, was he brought to you by the members of the correctional services or by the police wearing civilian clothes? And Hlokwa said in his recollection, there were men that were in brown uniform, of which from the time that we've been seeing prisoners, they come with their prison warders, which he identified as such. So Ntanzi was seen laughing there by the cameraman. And he also continued to say, and there was another one who was not dressed in brown uniform. So he assumed them to be a police officer.
Okay.
But other people were pointing it out that Metro Police people also wear brown uniform.
Yes, they do.
And they're saying that the SWAT at the time was also wearing brown uniform, allegedly. So
I'm not sure about that, but
I'm asking for confirmation. So Mgomezulu said, according to his version, those people were not from correctional services. They were from Metro Police officers from SWAT. So accused number 2 was not brought from prison, but from a police station. And Hlokwa said from his recollection, he remembered that someone was dressed in brown. And he said, you know what was really happening in that point of view, whether it's correctional services, in my view, people that are dressed in brown uniform are from correctional services. So Mnisi did his cross-examination, and he started his cross-examination off by asking Hlokwa if he knew of a certain professor, Mkhokong. Then Hlokwa said that no, in the middle he had to resign. He said that during his first year, that's when that professor was there. Mnisi asked comprehensive medical assessment. Do you still remember that word? And Hlokwa said yes. Mnisi said, where did it come from? He did not want a description of it. So Hlokwa said the fully clouded, a fully done examination of an individual given what you have in hand. So Mnisi was basically saying that under examination in chief, he was asked if he did a comprehensive medical assessment, and he said yes. So Baloyi stood to object, saying that that was not the question. They went back and forth until they eventually listened to the recording. And when they came back, they said that it confirmed what he asked. And Baloyi still denied it and said that this is not what he said. There was a tussle of words between Advocate Nisi and Advocate Baloyi. And when Advocate Baloyi told, he said that he told him to see that he can continue asking what he wanted to ask to the witness without listening to the recording. So there was that kind of scuffle that was happening between Advocate Nisi and Advocate Baloyi.
yeah, because he was called, basically he was said to be lying about what was asked. So Nisi was basically saying, let the record speak for itself.
For itself. And remember, guys, I told you to note that question down, because that is where the comprehensive medical report situation came back to haunt Advocate Baloyi. Nisi said that the state is in no way authorized to tell him how to conduct his cross-examination. He was upset. You can't tell me that we are saying this and you are saying something else, and we are saying let's listen to the record, and you don't want to. You are saying I must continue with what... Hlokwa said that from what he was asked, he does not remember saying it was comprehensive. Yes, you did not say it, Hlokwa. However, the state prosecutor said it, okay? And Mnisi told Hlokwa that he was not part of the dispute. And the judge asked Hlokwa what he remembers, and he uttered things that didn't make sense to me. But the volume of that recording was also low, but somehow they listened to it and they got what they needed. And Advocate Baloyi still maintained after listening to the record that that's not what he said. He tried to explain it by saying that what he was trying to say was that after all the comprehensive medical examinations are done, then they are referred to the dentist, which is not true in my opinion. That's not how he framed and put the question. That's not exactly how he made it sound. It wasn't at all. Now he was changing the meaning of the question that he asked. So he said it's an exclusive examination. Now we are moving from comprehensive to an... So yeah, it's very interesting. So Mnisi objected and he said, he who testifies to the question is a witness. The judge granted Mnisi permission to continue to cross-examine on what he heard. Mnisi asked Hlokwa, what is contained in a comprehensive medical report? Is this from you? You took this to the court. You took the court through this document.
Yes.
And Hlokwa said, let me answer you very correctly and clearly before you go and twist my words. Listen, this is a comprehensive dental examination. It's even reaching on the top dental services. And Gomezulu said, not Gomezulu, Nisi said, on what basis do you see that what you did to the patient instituted a comprehensive medical assessment and not a comprehensive dental assessment? And Hlokwa said, if you are going to talk about a comprehensive medical assessment, you guys should have went straight to the medical center and got the whole file of the patient and brought it here. Also the examiners that were there and the nurses that were there, because I'm part of a group, I'm not alone. I can't see what's the next date. I'm telling this story that I saw, the story that I did on my own. Okay, so now he's basically saying that that is not what it is, which is why I was saying, in my opinion, I don't think that is true, because now he's speaking about a file that needed to be looked for at the hospital, and yet he was testifying on everything that was done by the nurses and the administrators and the doctors and the GPs and the surgeons. He was testifying on behalf of them, and yet he didn't even have a full file of Ntanzi's comprehensive medical report, but he was somehow testifying on it, So yeah, he said, not me being dragged into a corner of things I'm not supposed to know. It's something else, And this could also, in my opinion, be interpreted as a slight jab to Advocate Baloyi, because that is exactly what he did to him. He made him testify on a comprehensive medical report that he did not have, that he did not have access to, that he doesn't have. Allegedly. So Mnisi then asked, no one is trying to lead you into a snare here. You are not being cornered here. I'm asking questions based on what you told the court. It is therefore an error to say it was a comprehensive medical assessment, because as you say, you don't know what the others did. So Hlokwa said, in my response, I did say everything that I've said and tried to point out is actually in this document. Before, I was basically doing my job. That is what I was supposed to have done. According to my scope of what I know, a comprehensive medical examination involving a dentist entitles this. I can't go do what a doctor does if I'm not a doctor. The file has everything. So I don't get what you are leading me to. Nisi then asked, what I'm putting to you is that it's an error to tell this court that what you did on that day is a comprehensive medical examination. In instances where you only dealt with this patient's teeth, Baloyi stood to object to say that the witness has repeatedly answered this question and that counsel keeps repeating the same question. And Mnisi said you start to assess the patient from his waist. And Hlokwa said that he had access. What you see, you don't examine. Because Mnisi had used the word examine instead of assess. And he was very cocky in correcting Mnisi. Making that correction, he sounded very cocky in my opinion, saying that, let's get it right. Let's get it right. I'm like, yo, Hlokwa. He was getting angry here and agitated. Mnisi then said, thank you for the lecture, sir. I think for the whole day you have given a lecture. It is a dentist, and you are a dentist. As a dentist assesses a patient from the waist upwards, you told the court that this form that you checked for his general appraisal. Now, a general appraisal is a look of patience. A slow process, in other words. So Mnisi mentioned everything else he said he had a look at. The state said to you, he asked, did the patient tell you that he was assaulted, or was that your answer? And did you get the answer? And Hlokwa said that the patient never stated any assault, only the image that was given from the policeman that came in and said that they were looking for whether the patient had a good gold tooth or not.
Yes.
And he said, I was not assessing for that. Meaning that when you assess for that, you need to state every question that's here, and you need to state what it means. So Mnisi asked the doctor, can you please understand the question? Then he repeated the question. The state asked whether the patient told you that he was assaulted. No, I'm asking you, what was your answer to that question? And Hlokwa said, my answer was simple. From me, my assessment, I didn't see any sign that the patient was assaulted. So Mnisi then said, Haibo, is that what the answer was when the state asked you that question? And Advocate Baloyi stood to object, asking, is this a memory test? The witness gives evidence in chief. If there's a question that my learned friend wants to ask, then he must ask it. How is the witness supposed to now play his mind back, remember that each and every question was, and what the answer was? We submit, my lord, that this is not fair. What did you think about this whole... Do you think Advocate Baloyi was upset?
He was upset.
Things didn't go his way?
Things haven't been going his way lately. I don't know. I feel like he's trying so hard. He ends up getting into places where there's no return. You cannot trust a situation, someone whose profession is to make sure that they do such testing of only the mouth. And then you come with that person, you make him look like a person who is an all-rounder. And now you are caught with your pants down because you have to now defend that person when they put him on the corner.
It was very bad, guys.
Yes.
It was bad. Mnisi even said there's nothing unfair about my question. I think my learned friend is a little bit rattled. Well, he turned to Hlokwa, Advocate Mnisi, and he said, I'm well within my rights to ask you to repeat the question that my colleague asked you. And Hlokwa kept interrupting him. And then Mnisi told him that this is not a circus. When my colleague asked you this question on whether or not the patient that you saw on that day told you that he was assaulted, your answer was no, he never told me. Is that not what you said? And Hlokwa said, is there anything here in this document that says I should ask a patient if they were assaulted? Awajiga manju Hlokwa, wajiga, what 360 about? Nisi said, I seem to doubt your level of understanding of what I'm saying. And to basically go down to the level of you understanding me as a doctor, I thought at some stage you might, you being a doctor, plus minus, you and I would be on the same level of understanding each other. But the way in which your trajectory is proceeding, I seem to have a very serious problem, painting it out to him that, what, as a doctor, I expected you to be like, but you are, not at the same level. So, yeah. He said, did you expect him to give you that answer when you did not ask him that question? And Hlokwa said no. And Mnisi asked, did it ever occur to you in your mind that you should ask him whether he was assaulted? And Hlokwa said, I'm not supposed to ask whether a patient is assaulted or not. That's a medical officer's way of doing things. I'm able to identify if there's any signs and then report them. But yet he was there in his examination in chief speaking on signs on whether the accused had been assaulted. Mnisi said, you said that you did not find a possible sign that may suggest that he was assaulted. In your examination of the patient on the notion that this was a comprehensive medical examination, did you check his eyes, ears, nostrils? And he said, Hlokwa, I go to the file, everything is in the file. I'm not eligible to open the patient's nose and check what's inside of it. I didn't speak of that. Mnisi then said, would you dispute it if I put to you that had you gone an extra mile, and I know that that was not your area of operation, but had you gone an extra mile to check his eyes and to examine his eyes or to examine his ears, there could have been possible signs that could have helped you conclude that something had happened to this gentleman. Do you dispute that? And Hlokwa said, examination of the eyes is done by an optometrist. Angithi nazoke. For the ear is done by an audiologist. So if I go in extra mile, I will be doing what's within my scope. So as a result, I cannot be able to confirm or deny those things because that's not my job. It's the same as asking a carpenter whether the car has an oil leak or not. Yet you were testifying, Dagama, on the work that was done by other people. Then Nisi said, do you realize that the fact that you told this court that on your examination you could not determine or not that the patient that you saw on that day was assaulted or not, that conclusion is based on a very light accusatory. The word came from the judge. It means very light examination of what you did on that day. So Hlokwa said, I was not here to confirm or make sure whether the patient was traumatized or whatsoever. I was going to read the thing that I filled up, the document that I had in my possession. That's what I was here for. Basically, that's the information that you are directing to the state. Do you have that has called upon you here to come and state whether the patient that you saw on that day was assaulted? Nisi asked him. And I put it as well that he was engulfed in the trap by the state to come and testify to things that he did not know, in my opinion. And I still maintain it. So Advocate Nisi placed it in this beautiful question over here. And Hlokwa said, the message that I'm delivering is, yes, I took an oath. Now you remember that you took an oath. Whenever I'm required to come and explain what I've done, I'm supposed to come in front of the court whenever I'm required and explain what I've done. I'm not here to confirm whether the patient has gone through trauma. I'm supposed to say from what I've seen, my examination, what does it say to everyone that sees the page? Does it say that the patient was traumatized, has any sort of lesions or any sort of disease? That is what I am here for. So basically he's denying that he's not a dibble and a debba of of expertise that do not concern him. He's sticking to what he knows. So Mnisi then says, so you're basically saying that you can't tell whether the patient was assaulted or not. The patient that you saw on that day, and Hlokwa said you can, at certain instances, severities whereby we were taught. He went on and on about a patient having a blue eye. A patient can appear and they say they have internal bleeding. He eventually conceded, though, to say that he was not supposed to go the extra mile and check that there is a specialist who can check that. He was supposed to refer to a specialist who can check for such. He eventually conceded, guys. Yeah, Hashem, the man can talk. That man can talk. So Mnisi said, because you are not that person, you therefore can't say, you can't dispute as a matter of fact that the patient that you saw on that day, prior to you seeing him, he was assaulted. And Hlokwa said, maybe you didn't understand what I have narrated to you. It reminded me how Gininda would answer this part. Talk too much, give Dr. Matthew vibes, confuse everyone, and as they are confused, make them look for the answer in this whole essay that you have just written, and spoken about. So he said, let me debrief. Understand here, there's a certain extent whereby you are able to identify such things, but there are some extents that you can't. Well, he considered that he was told to look for the gold tooth. He said that he didn't see any signs from what he had seen. Other things he could have needed to be examined by other doctors. What he saw was on the file. Yeah. So Mnisi asked him if he understood the question, and he asked Mnisi if Mnisi understood what he was saying. The judge eventually jumped in to encourage Mnisi to just put it to the witness. Otherwise, they were going to be there forever and ever. And I agree with the judge here. Here is where I agree with the judge that, we can move on. We can, yes. So, yeah. Also, I wanted to bring in this topic, Mr. Anonymous. I don't know whether you feel comfortable discussing it. There's this bad rumors that are surrounding Medunsa doctors. And I'm not disputing that there are amazing doctors that come from that institution. But there's also this bad bunch that has given kind of a bad omen to Medunsa doctors. And listening to this dentist testify, I grew up around that area, and there would be criticism against Medunsa doctors, and I'd always wonder why. But doctors, Ifosonke, you did not represent Medunsa well. And yes, guys, please don't say I'm including everyone who studied in that institution. There are very good doctors who come from that institution. Very good, specialized, everything. They tick all the right boxes. Bakhona, they exist. But growing up around that area, I used to hear like bad vibes,
Look, I'm not gonna reduce this to an institution. I'm not. Knowing this case, I think I would not even bring that into
up.
Yeah.
Okay.
It's. The case has tendencies of turning people into things that they are not.
Good point. Well, Mnisi said, I'm putting it to you that you were not in a position to say that the patient was shown to you that day or was assaulted. Do you have any comment? And Hlokwa said, I don't have any comment. Well, Mnisi concluded his cross-examination. Advocate Nxumalo didn't have any cross-examination for the witness, but Advocate Mshololo stood to cross-examine. And she asked him again what the document he has been testifying on is called, and it's actually a comprehensive dental exam. So, asked if it is a report or a recording, Hlokwa said that it's a file where you assess, you write down and report He even said that it's a progress report. And Mshololo asked, according to you in this form, you will record every examination done on the patient. And Hlokwa said, of course, yes, of course, And Mshololo said, you testified in your examination in chief that you have examined the upper body of the accused. And Hlokwa said, corrected her to say not examined, but inspect. It's funny how in the evidence in chief he was examining, but now under cross-examination, he's inspecting and assessing. Yeah. So, Shalolo asked, from an examination of the upper body of the accused, you did not ask him to take off his clothes. And Hlokwa said, it's not my job to ask the patient to take his clothes off. Nisi was offended by Hlokwa, pointing at him, apparently when he was saying, this is where I wish I could see these witnesses as they testify, because Nisi was saying that he was pointing at him and saying at him, calling this man, and he said that he does not like how he's sounding sarcastic when answering questions and referring to him. And he was saying that he is a sir, he's an advocate of this court, At that point, he was asking for respect, And he said, I'm going to refer to this court to respectfully address this witness to answer the question directly and to avoid sarcastically referring to me, So furthermore, in his testimony, Mshololo continued after that whole situation. Furthermore, in your testimony, you were asked about the injuries, if the accused had any injuries on his face. And you said that there were no injuries on his face that you noted or observed. How many patients did you see on this particular day? And Hlokwa said that he saw, he said 3 of them are the ones that were working on that day, but he could not recall how many patients he saw on that day. So Mshololo asked, you did not record in this document that you observed the face of accused number 2 and that there were no injuries. And Hlokwa said that there is no question in the file that said that he should have recorded that. He said he was recording what he was seeing. Were you recording what you were looking for? That is the main question. Mshololo then requested him not to be too long when answering. Asking that he is a doctor by profession, right? And the state stood to object. That's Advocate Baloyi. He objected and said, Shololo is shouting at the witness. Do you think she was shouting?
No.
So desperate times call for desperate measures?
Yeah, you need to put the witness in line so that he answers your questions accordingly and short, and the understanding is clear.
Well, Shololo said, how do you recall that the accused did not have any injuries on his face if you cannot recall the number of patients that you treated on that day? And Hlokwa said, I'm going to go back and then I'm going to say this. That site, we barely see any sight of anyone in handcuffs. Now they barely see anyone in handcuffs or any sort of prisoner that was there. So on that day, and specifically on that day, he was the only prisoner that I had ever seen. Meaning what was happening there, anyone who's ever experienced that moment of something they've never seen before, you can basically recall it. So he further said that he was not a normal patient. Ntanzi was not a normal patient that he usually has. So what was the need of mentioning that at Medunsa you were seeing prisoners every now and again? So Mshololo asked, the fact that you did not record that in this document that you found that there were no injuries on the accused's face, and whatever that finding, you should have recorded it here. In that absence of that recording here, it means that you are fabricating the story today. You never observed the accused on that particular day on his face. And Baloyi stood to object, saying that the witness has already said that and there's no need to repeat the question. Mshololo asked, are you a district surgeon as well? And Baloyi objected to say that the witness said he was a dentist. That's his area of expertise. The judge also schooled them about this cross-examination again, and that one day the trial, when it's over and done, they should sit down and learn from this cross-examination. He said that there's a debate that they were making with the witness. It was not helping the court. And he said that it's a debating school now. Yeah. I kind of agree with him on this point. So Mshololo said, do you know a form that is called a J88? And Hlokwa said yes. Mshololo asked, do you know that this is the form that is used by a district surgeon when they are conducting examination to a person? And Hlokwa said, I do. Mshololo asked, and in that form, the doctor will record the injuries or the condition of the person that he examined on that day, particularly. Am I correct? And Hlokwa said, I do. Shololo showed him his document, and he said that this is not a prescribed form that is used to record the injuries observed by the doctor when he's examining a patient. Do you agree with me? And Hlokwa said, I agree. Mshololo went to the part where it said consent on that document, the one that was brought up by the judge. And Mshololo asked, were you present when this portion was completed? And Hlokwa said that the handwriting was his, so yes, he was present on that day. He was also present when the signature was placed there. He said that the patient is the one who signed, and he was present when the patient was signing. And Mshololo asked, did you explain specifically to the accused what he was signing here? And Hlokwa said he was supposed to do that. It was part of his job. And Mshololo asked, in what language did you explain? And Hlokwa said he used English. Mshololo asked, did you ask the accused if he understood English? And Hlokwa said at the beginning, when they were busy assessing the patient, he asked for an assistant because his Zulu is not proper. He said that he was helping with the Zulu part, the assistant. And he would ask the questions in English, and there was an interpreter, the assistant, that explained what he was saying to the patient in Zulu. Now, somehow, I don't know if I believe this, but it is what it is. That's what he's saying. And then Mshololo asked, but when you completed the consent part, the interpreter was no longer there. And Hlokwa said the assistant remained there throughout. They don't leave. He said, I leave before them. They're supposed to give the patient instructions of something that they're supposed to do, and are the ones who also are responsible for dismissing the patient. While Mshololo was done, there was no re-examination. Advocate Baloyi, he resigned. He was like, no re-examination for the first time. There's nothing he needed to clarify with Dr. Zifozonke.
Yeah.
Yeah, and he won't be available next week. He says he won't be in court next week. So that's going to be interesting, considering the fact that the defense is starting with calling their own witnesses to the stand. Now they are presenting, the defense will be presenting their case now.
Yeah.
So he won't be there. Advocate Baloyi will not be there. He will have his assistant there assisting him.
Yeah, I think that is it.
Yeah, that's it. We are done, guys. We are done. I don't know whether we should open the lines or if there's any engagement of such. No, nah.
It's in the morning.
Okay, we'll try again next week, guys. I'm struggling. I'm struggling to keep up with this case. But we'll soldier on, guys. We'll soldier on.
We will. Good morning. Very good morning, guys, for those who are in South Africa and outside South Africa. If it's a morning, very good morning, and enjoy. Let us see each other. Probably we might come up with something that we need to work on, but I mean, thank you. Yes, indeed, Ntokozo. Thank you, guys.
Thank you, guys.
It's humbling. Mamela. Thank you, Ned. Thank you, Dali. Thank you, Victor. Thank you.
Thank you, Victor.
Colin Dove, thank you.
Colin Globe, thank
And
you.
you
Nat.
guys have been busy, yes, Nat. Say. And then Nolundi Ngwale, thank you. Yes. Tsidi Anna, thank you. This is our member.
Hello, member Tsidi.
Lawrence.
Tsidi.
Hout, thank you. Kulegan Intlizio, thank you. And Didi Talks.
Didi Talks, thank you.
And we had, I think, Ruth.
Hi,
Thank
Ruth.
You. Yeah. Maloloza. Thank you. Thank you,
Maloloza,
guys.
thank you.
Yes, that's basically it. Chabiso, thank you. You
Thank
were
you,
there.
Chabiso.
Tembimadi, you were there in the morning. Guess this is a morning gang. Saga, no, Seha. Thank you. And then, yeah, blessings, Mabena. Yes, that's it. Thank you guys from us in the morning. Thank you for being patient and waiting for us to eventually deliver this. We have, and we hope that you're going to enjoy it. It has been a week.
Yeah, it has been a week. Let me go sleep now.
Yes. You.